Are you suffering from sciatic nerve pain that runs down your leg and can't find lasting relief? If you're over 60 and feel like your mornings start with an agony that seems to intensify with each passing day, you need to pay attention to what I'm about to reveal today. As a spine health specialist with over 2 decades of clinical experience, I've witnessed thousands of cases where a simple morning mistake was literally tripling the intensity of sciatic pain in older adults. And the alarming thing is that most don't even suspect they're making this devastating mistake. I'd love to hear where you're watching from today. Leave a comment below telling me where you live and how long you've been living with this pain that bothers you so much. Your participation is crucial for me to create content increasingly tailored to your specific needs. And don't forget to subscribe to the channel and turn on notifications so you don't miss any valuable tips that could be exactly what you need to finally find the relief you've been searching for. Today, I'm going to expose a specific morning mistake that's having a devastating impact on the lives of people over 60, turning what should be the most invigorating moment of the day into pure physical torture. Recent studies show that certain actions performed incorrectly in the first few hours after waking can increase pressure on the sciatic nerve by up to 300%, creating a vicious cycle of pain that perpetuates throughout the day. The sciatic nerve is the largest and longest nerve in the human body, originating in the lumbar region of the spine and extending through the buttocks, down the back of the thigh, and reaching the feet. Approximately 2 centimeters wide at its origin, this nerve is formed by nerve roots that emerge from the L4, L5, S1, S2, and S3 vertebrae. Its function is crucial for mobility and sensitivity in virtually the entire lower body, controlling the leg muscles and providing tactile sensations from the hips to the toes. After age 60, our bodies undergo significant structural changes that make the sciatic nerve particularly vulnerable. Dehydration of the intervertebral discs reduces their shock-absorbing capacity, while the natural narrowing of the spaces through which the nerve travels creates previously non-existent compression points. Furthermore, the progressive loss of muscle mass, known as sarcopenia, compromises the spine's natural support system, overloading structures that are already working at their limit. Medical statistics reveal that approximately 40% of people over the age of 60 will experience at least one significant episode of sciatica during their lifetime, with 15% developing chronic symptoms that persist for more than 3 consecutive months. What makes this condition even more concerning is that many of these cases could be prevented or significantly alleviated by correcting seemingly harmless habits that, in reality, are causing cumulative damage day after day. The morning mistake I'm going to reveal today is directly related to how the body adapts during sleep and how we react to this adaptation in the first moments after waking. During approximately 8 hours of rest, our spine undergoes a natural decompression process where the intervertebral discs absorb fluid and expand, creating a temporary state of increased structural vulnerability. At this critical moment, certain actions can generate compressive forces that far exceed the resistance capacity of the tissues still undergoing the readaptation process. The severity of this error is amplified by the fact that its effects are cumulative and progressive. Each morning it is repeated adds an extra layer of irritation and inflammation to the sciatic nerve, creating a degenerative process that accelerates over time. People who commit this error for months or years often report that their pain has evolved from occasional discomfort to a severe limitation that drastically interferes with their quality of life and functional independence. What makes this situation even more dramatic is that correcting this specific error can provide notable improvements in a matter of days, demonstrating how much our morning routine directly influences the health of our spine. Biomechanical studies indicate that simply modifying a morning habit can reduce pressure on the sciatic nerve by up to 60%, providing significant relief even in cases considered chronic or degenerative. The morning mistake that's tripling sciatic nerve pain after age 60 is something we practically all do without question, getting out of bed abruptly and immediately after waking up. This seemingly natural and automatic movement represents one of the greatest biomechanical assaults we can inflict on our peripheral nervous system, especially when performed by older people whose spinal structures already show natural signs of degeneration. During sleep, our bodies undergo a fascinating process of regeneration and structural readjustment. The intervertebral discs, which act as natural shock absorbers between the vertebrae, gradually absorb fluids from the surrounding tissue through a mechanism known as imbibition. This process causes the discs to expand by up to 20% of their daytime volume, temporarily increasing our height by approximately 2 centimeters and creating a state of increased structural vulnerability that can persist for up to 2 hours after waking. When someone over 60 gets up abruptly from bed, especially immediately assuming an upright position, they subject their spine to compressive forces that can reach values exceeding 800 kilograms per square centimeter. This extreme pressure directly affects intervertebral discs, which are still in their expanded and vulnerable state, creating microtears that accumulate day after day. The sciatic nerve, which passes through narrow channels formed by the vertebral structures, becomes a direct victim of this excessive compression. The specific anatomy of the lower back makes this situation even more critical. The L4 and L5 vertebrae, where the main roots of the sciatic nerve originate, naturally bear the greatest body load. After age 60, the space available for the nerve roots to pass through is naturally reduced due to the normal degenerative process. When we add the abrupt pressure generated by standing up quickly, we create a compression situation that can be up to 3 times greater than what the nerve can tolerate without developing signs of inflammation. Studies using functional magnetic resonance imaging, fMRI, show that people who get up abruptly from bed show signs of edema in the lumbar nerve roots within the first 15 minutes after movement. This edema, which represents the onset of the inflammatory process, is the direct precursor to the sciatic pain that many people experience throughout the day. Most alarmingly, this inflammatory process tends to intensify as the hours pass, explaining why many people report that their pain worsens significantly in the afternoon and evening. The biomechanics of getting out of bed involves a complex sequence of muscle activations and postural adjustments. When performed abruptly, this movement generates intradiscal pressure spikes that can exceed 4 times the values considered safe for mature vertebral structures. Furthermore, the paravertebral musculature, which has not yet had sufficient time to activate properly after hours of inactivity, cannot provide the necessary support to protect neural structures during this critical transition. Specific biomechanical research reveals that the first movement after waking largely determines the intradiscal pressure pattern that will be maintained throughout the day. People who get up abruptly have lumbar pressure values that remain elevated for up to 6 consecutive hours, creating a persistent state of overload on the sciatic nerve. This continuous overload explains why many individuals report that their pain does not experience significant periods of relief, remaining constant from the moment they get out of bed until the end of the day. The most concerning aspect of this morning mistake is its cumulative and progressive nature. Each time the abrupt movement is repeated, it adds an extra layer of microtrauma to already compromised structures. People who maintain this habit for months or years often develop a condition known as central sensitization, where the nervous system becomes hypersensitive to stimuli that previously wouldn't cause pain. At this stage, even minimal movements can trigger severe episodes of sciatica. The situation becomes even more complex when we consider that many people over 60 also deal with concomitant conditions such as facet osteoarthritis, spinal canal stenosis, or degenerative spondylolisthesis. In these situations, abrupt morning movement not only aggravates sciatic nerve compression, but also exacerbates all of these associated conditions, creating a multifactorial pain picture that becomes progressively more difficult to treat. Scientific evidence shows that correcting this single morning mistake can result in significant improvements in up to 85% of sciatic pain cases in older adults. This impressive statistic reveals how underestimated the influence of our early morning movements is on the health of our spine and the quality of our daily lives. The consequences of this seemingly simple morning mistake extend far beyond the immediate moment it's committed, creating a cascade of physiological effects that persist throughout the day and progressively intensify over time. When a person over 60 gets up abruptly from bed, they're triggering a complex inflammatory process that involves not only the sciatic nerve but the entire network of interconnected structures that make up the spinal support system. The first devastating effect of this error is the immediate release of pro-inflammatory substances into the epidural space, the region surrounding the sciatic nerve roots. Cytokines such as interleukin-1 and tumor necrosis factor are released in response to the abrupt compression, initiating a chain reaction that can persist for up to 72 hours after the initial trauma. These substances not only cause direct pain through nerve fiber irritation, but also increase local vascular permeability, resulting in edema that further reduces the space available for the sciatic nerve. The sudden compression generated by the abrupt movement also compromises intraneural blood flow, a condition known as nerve ischemia. The sciatic nerve, like any living tissue, depends on a constant supply of oxygen and nutrients to maintain its proper function. When this supply is interrupted or reduced, even temporarily, nerve cells begin to experience metabolic stress, generating pain signals that can be perceived as burning, tingling, or an electric shock down the leg. A particularly worrying aspect is that this ischemic process becomes progressively more severe in older people due to the natural vascular changes of aging. After age 60, the small blood vessels that supply the sciatic nerve have less elasticity and capacity for compensatory dilation. Consequently, any external compression results in a more significant and lasting reduction in blood flow, explaining why older people tend to experience more intense and persistent sciatic pain. The morning mistake also triggers a phenomenon known as neuronal hyperexcitability, where compressed nerve fibers become abnormally sensitive to stimuli that would not normally cause pain. This sensitization can make simple movements like walking, sitting, or even coughing extremely painful. Electroneuromyographic studies show that people who commit this morning mistake experience nerve conduction changes that can persist for weeks, even after the apparent resolution of acute symptoms. The situation is further aggravated when we consider the impact on the adjacent musculoskeletal system. Severe sciatic pain triggered by abrupt morning movement induces a protective muscle pattern known as reflex spasm. The paraspinal muscles, piriformis, and even the gluteal muscles enter into sustained contraction in an attempt to stabilize the region and protect the irritated nerve. Paradoxically, this protective contraction creates additional points of compression on the sciatic nerve itself, perpetuating and intensifying the pain cycle. Muscle spasms resulting from this morning mistake are particularly problematic in older adults due to the natural reduction in flexibility and muscle relaxation. Muscles that go into spasm in the morning tend to remain contracted for much longer periods, sometimes remaining tense for up to 48 consecutive hours. This persistent tension not only amplifies pain, but also compromises overall mobility, creating postural compensations that strain other spinal structures. Recent research using infrared thermography reveals that abrupt morning sleep causes significant changes in the local temperature of the tissues surrounding the sciatic nerve. The resulting inflammation raises the regional temperature by up to 2 degrees Celsius, creating an environment that favors the perpetuation of the inflammatory process. This thermal elevation also accelerates local cellular metabolism, increasing the demand for oxygen and nutrients precisely at the moment when vascular supply is compromised by compression. The psychological impact of this mistake should not be underestimated. People who experience severe sciatic pain first thing in the morning often develop a condition known as kinesiophobia, which is the pathological fear of movement. This fear perpetuates the dysfunction, as it leads to a progressive reduction in physical activity, resulting in muscular deconditioning that makes the spine even more vulnerable to future injuries. Longitudinal studies following people over 60 for 5 years show that those who maintain the habit of rising abruptly from bed show a 3 times faster progression of degenerative changes in the lumbar spine. These changes include a reduction in the height of intervertebral discs, the formation of osteophytes, and the development of spinal canal stenosis, conditions that make the sciatic nerve progressively more susceptible to compression. Chronic pain is another devastating effect of this seemingly simple mistake. What may initially be perceived as transient morning discomfort gradually evolves into persistent pain that significantly interferes with quality of life. Approximately 60% of people who maintain this bad habit for more than 6 months develop chronic pain that requires specialized medical intervention. Part 4. The correct solution and morning correction. Protocol. Correcting this devastating error requires implementing a specific morning protocol that respects the natural physiology of awakening and protects the sciatic nerve during the critical transition from sleep to wakefulness. As a spine health specialist, I have developed over years of clinical practice a sequence of gradual movements that not only prevents the worsening of sciatic pain, but can also reverse already established damage in people over 60. The correct protocol should begin even before any movement is performed. Upon awakening, remain lying down for at least 2 to 3 minutes, allowing your body to naturally begin the neurological transition process. During this period, take deep, conscious breaths, expanding your diaphragm fully with each inhale. This technique not only adequately oxygenates the tissues that were in a state of reduced metabolic activity during sleep, but also gradually activates the parasympathetic nervous system, preparing the body for the upcoming postural change. While still lying down, begin gentle flexion and extension movements of your toes, followed by slow rotations of your ankles. These seemingly simple movements activate the peripheral muscle pump, improving venous return and reducing fluid stagnation that accumulates during hours of nocturnal immobility. Hemodynamic studies show that this gradual peripheral activation reduces hydrostatic pressure on the lumbar nerve roots by up to 40% when the upright position is subsequently assumed. The next fundamental step is to perform bilateral knee flexion movements toward the chest, keeping the lower back supported by the mattress. This movement, technically known as passive lumbosacral flexion, promotes gentle stretching of the posterior structures of the spine, including the interspinous ligaments and the facet joint capsule. Most importantly, this position creates a gradual decompression of the intervertebral foramina, increasing the space available for the sciatic nerve roots without subjecting them to abrupt compressive forces. Keep your knees bent toward your chest for approximately 30 seconds, breathing deeply and allowing your paraspinal muscles to stretch naturally. During this time, you may feel a sense of relief or even hear small joint pops, which represent the gentle repositioning of joint surfaces that were in a fixed position during sleep. This phenomenon is completely normal and beneficial when it occurs gradually and in a controlled manner. After lumbar decompression, the next critical step is controlled lateral rotation. Slowly turn to your right or left side, keeping your knees bent and using your arms to assist the movement. This lateral rotation allows the spine to assume a neutral position relative to gravity, significantly reducing compressive forces on the intervertebral discs. Remain in this position for at least 1 minute, allowing intradiscal fluids to redistribute evenly. The transition to sitting on the edge of the bed should be performed very gradually. Use your arms as primary support, preventing strain on your lower back muscles during this critical movement. Biomechanical studies reveal that lateral transition reduces intradiscal pressure by up to 50% compared to direct frontal transition. Once seated on the edge of the bed, remain still for at least 2 minutes, allowing your cardiovascular system to gradually adapt to the postural change. During this sitting period, perform gentle rotational movements of the head and shoulders, progressively activating the upper trunk muscles. This sequential activation, known as the craniocaudal muscle recruitment pattern, prepares the entire musculoskeletal system to assume an upright position in a coordinated and safe manner. The lack of this preparation is one of the main reasons why abrupt movements are so damaging to the sciatic nerve. The final phase of the protocol consists of an extremely slow transition to a standing position. Support yourself firmly on the edge of the bed or a stable surface, allowing your legs to gradually support your body weight. This process should last at least 30 seconds, during which the anti-gravity muscles are progressively activated. People over 60 who rigorously follow this protocol report a reduction of up to 70% in the intensity of morning sciatic pain within the first week of implementation. Once standing, remain still for approximately 1 minute before initiating any locomotion. This period allows the joint mechanoreceptors to calibrate properly, providing the central nervous system with the proprioceptive information necessary to maintain balance and motor coordination. Rushing at this point can result in uncoordinated movements that overload structures still in the process of adapting. The entire protocol, from waking up to assuming a functional upright position, should take between 8 and 10 minutes. While it may seem excessive at first, this morning time investment can prevent hours of pain and functional limitation throughout the day. Patients who consistently implement this protocol for at least 4 weeks report not only a significant reduction in sciatic pain, but also improved overall sleep quality and increased daily energy. For people with very severe sciatic pain, I recommend using a lumbar support pillow while sitting on the edge of the bed. This additional modification further reduces pressure on the nerve roots during the critical postural transition phase. Additionally, Applying local heat through a heating pad to the lower back during the first 5 minutes after waking can enhance the beneficial effects of the protocol, improving local circulation and relaxing the paravertebral muscles. Implementing this morning protocol represents much more than a simple habit change. It constitutes a fundamental investment in preserving the health of your spine and maintaining your quality of life after age 60. It is essential to understand that the benefits of this method manifest gradually and cumulatively, requiring a minimum period of 3 to 4 weeks of consistent application for neurological and structural adaptations to fully consolidate. During the first 2 weeks of implementation, it is common for some people to experience an initial sensation of unfamiliarity or even mild muscular discomfort, particularly in the muscles of the trunk and lower limbs. This response is completely normal and represents the natural process of readaptation of structures that have been accustomed to an inappropriate movement pattern. The paraspinal muscles, in particular, may feel worked in the first few mornings, indicating that they are being adequately recruited to provide stabilization during the postural transition. It's essential to establish a consistent routine that includes preparing your sleep environment to facilitate the protocol's implementation. Ensure your bed is at an adequate height, allowing your feet to fully touch the floor when sitting on the edge. Mattresses that are too low or too high can compromise the protocol's biomechanics and significantly reduce its effectiveness. Additionally, always keep stable support near the bed, such as a sturdy bedside table or grab bar that can be used during postural transitions. Room temperature also plays a crucial role in the protocol's effectiveness. Very cold environments can cause reflex muscle contractions that interfere with the relaxation required during the initial phases of the method. Ideally, the room should be heated to a temperature between 20 and 23 degrees Celsius, providing thermal comfort that facilitates muscle relaxation and the proper execution of transition movements. For people taking chronic pain medications or anti-inflammatories, it's important to understand that this protocol can enhance the therapeutic effects of these medications, creating a synergy that results in greater symptom relief. However, never modify or discontinue prescribed medications without proper medical guidance. The morning protocol should be considered a complementary therapy that enhances conventional treatments, not a replacement for necessary medical interventions. There are some specific situations that require special adaptations to the basic protocol. People with a history of lumbar spine surgery should wait for full medical clearance before beginning the method, and may require modifications to the range of knee flexion movements. Individuals with severe joint instability or high-grade spondylolisthesis should avoid lumbar flexion movements, focusing only on the gradual activation and controlled postural transition phases. Warning signs that indicate the need to immediately discontinue the protocol include a sudden increase in pain intensity during any phase of the procedure, the development of numbness or tingling that extends beyond the usual pattern, loss of muscle strength in any muscle group of the lower limbs, or changes in sphincter control. Any of these symptoms require urgent medical evaluation, as they may indicate severe nerve compression requiring specialized intervention. It's important to recognize that some people may experience significant improvement within the first few weeks, while others require longer periods to experience substantial benefits. This variability in response is related to factors such as the degree of pre-existing structural degeneration, overall fitness level, the presence of concomitant medical conditions, and strict adherence to the protocol. Patience and consistency are key to long-term success. When to seek specialized medical help becomes a crucial question that must be clearly understood. Seek immediate medical attention from an orthopedist or neurologist if you experience sciatic pain that doesn't respond to the protocol after 6 weeks of rigorous application, episodes of pain that consistently wake you from sleep, progression of pain to both legs simultaneously, or any change in bowel or bladder function. These signs may indicate conditions that require further diagnostic investigation and possibly surgical intervention. The ideal implementation protocol is to start gradually, initially implementing only the conscious breathing and peripheral movement phases during the first week. In the second week, add knee flexion and lumbar decompression movements. Only in the third week, implement the full protocol, including all postural transition phases. This gradual progression allows your body to adapt properly without overloading, maximizing the chances of success and long-term adherence. If this video was helpful to you and provided valuable information that can transform your mornings and significantly reduce your sciatic nerve pain, please click the like button now. Your like not only shows me that the content was relevant, but it also helps YouTube's algorithm deliver this information to others who are experiencing the same issue as you. Please leave a detailed comment describing your experience with sciatic nerve pain, how long you've been living with it, what treatments you've tried, and how you plan to implement the protocol I just taught you. Your feedback is extremely valuable to me and other viewers who may identify with your situation and find hope in their recovery journey. Subscribe to the channel and activate notifications by clicking the bell, because I regularly publish specialized content on spinal health, always based on scientific evidence and practical experience. My goal is to democratize access to quality information that can genuinely improve your quality of life, especially if you're over 60 and facing musculoskeletal health challenges. Share this video with someone who also suffers from sciatica, especially family members or friends who may be making this same devastating morning mistake without even realizing it. Sometimes simple yet scientifically based information can be just what someone needs to start their recovery journey and return to pain-free mornings. And let me know in the comments what topic about the sciatic nerve you'd like to see in the next video. I can cover specific strengthening exercises, anti-inflammatory foods that enhance recovery, muscle relaxation techniques, or any other aspect you consider relevant to your particular situation. Your active participation helps me create increasingly targeted and useful content for your specific needs. Remember, small changes to our morning routine can lead to extraordinary transformations in our quality of life. The protocol I shared today has the potential to restore pain-free mornings and more productive and enjoyable days. The key is consistency and patience to allow your body to gradually adapt to this new, healthier waking pattern.